And welcome back to Boom and Bust. I'm your host, Tony Clement, here with Dr. Chandana Unnithan. She is the Chief Scientific Officer at Lifeguard Digital Health. Doctor, we were talking a little bit about telehealth before the break. There are other innovations and technologies that are also playing a part. Where does blockchain fit in your estimation?
Um, Blockchain has over a decade over the last 5 years, it's become a very important area, particularly when it started getting utilized in the healthcare. If you're looking at national the health records or similar, there has been a lot of negativity associated with blockchain previously, maybe due to other sectors. However, once the health sector began using it, there's been a lot more traction into this area where it's used on not only for security of transmission and also security of data. And there's also, unlike people's ideas, there are decentralized hyperledger solutions that are available and is being used for public key infrastructure. It's being used by governments, and these are solutions that bring this technology and build trust, particularly in general public, dealing with healthcare.
So I guess one of the things is blockchain can assist in securing privacy rights. Is it also involved in the accumulation of data from patients, but also in a way that protects their individual privacy rights? Is that part of the solution as well?
That's correct. So it is transmission security mainly and authentication. And the decentralized form of the hyperledger solutions have now become one of the key areas where the person it could be a person, not only a patient, it could be the general person who is looking at the wellness, can be protected while the data is being transmitted, for example, from a mobile device onto a storage. And at that time, the reason this is very important at this time, if you think about solutions such as if you have a pacemaker or ICD device, and what happens if this gets if someone tries to hack in or jam the device. So it's very important in such a situation. The blockchain solutions, particularly currently, the novel technologies is combining this with edge computing, so that there is both these technologies have their own drawbacks, and combinedly they are a good solution for healthcare.
And what about artificial intelligence? Does that technology help as well?
Artificial intelligence is has been introduced in many ways. One of the highlights recently has been things like synchron, trying to put in chips, and if someone's immobile and able to still work with their mind and so on. The technologies in artificial intelligence has brought in a lot more. The trust is still to build, and there's how much of it is being used and for what purposes it is being used. If it's a virtual triage for regular certain areas peer to peer, it may be a start of building the trust in the medical sector. But if it has to be used further and it gets into a regular use into the health sector, it is still some time.
Gotcha. I mean, that's a good point, though. A lot of this new technology can be so revolutionary, but you do have to have some buy-in from the health providers too, right?
Yes, it is health providers as well as the general public who needs to trust. Some are, in health sector, trust is a very important factor. Public are mostly very happy to use it for other areas like finance, but when it comes to health, people do get vulnerable and the trust has to build over time. And the trust across geographies are different. Not every country or every geography is at the same level in accepting technologies.